Good morning, everyone. This year I will also present a talk on the change in eye color. I will compare my technique, depigmentation laser, with corneal tattooing, which is known as depigmentation. In the presentation, I'll outline the advantages and disadvantages of both methods and discuss the long-term effectiveness of each procedure in detail. Depigmentation laser is a procedure that utilizes a specialized laser to eliminate the pigment on the front surface of the iris, resulting in the accomplishment of full depigmentation. It is an outpatient treatment without anesthesia, organized in several phases. The results obtained are always natural and closely related to the patient's genetic characteristics that influence the final outcome. They are usually blue, turquoise, or grayish, and the effect is always natural, subtle, and permanent. Here we see some examples on the left of cosmetic indications for treating moles with larger or smaller genitals. On the right side, however, we can observe heterochromia, which is a condition that occurs following traumas, surgeries, and the topical application of prostaglandins. The latter refers to products that are utilized to promote the growth of eyelashes, but they can also result in, as a side effect, the gradual darkening of the iris. Keratopigmentation, the other technique that could be an alternative, involves injecting biological dyes into corneal tunnels that were previously created with the laser. The treatment is surgical and requires anesthesia. The surgical procedure lasts about an hour, with possible touch-ups for color diffusion and the fading of the effect over time. The outcomes are customized and the impact is significant. Nonetheless, it seems artificial and enduring, as we will observe later in the subsequent examination. We do not practice this technique. We focus solely on depigmentation with laser, and here we already see differences in the results. These are typical results of keratopigmentation procedures. Let's consider the past cases on the left and the current results in the center to have a complete view. We can observe a ring on the outer part of the eye, made up of 3/4 of the cornea, which display various colors due to the use of different dyes. On the left, we see a cross-section of the iris, a histological cross-section of the iris. So the green arrow indicates the pigmented anterior layer that undergoes treatment with the laser in the procedure. Beneath this layer, which is an extremely thin layer, as you can observe, that provides color to the eyes, there exists the stroma that constitutes the majority of the iris. And on the back, as you can see from the small red arrows, there is the pigmented back layer of the iris that is always very similar, even in congenital blue eyes without pigment. On the front layer to the right, you can observe a summary of the keratopigmentation technique. To begin, the femtosecond laser is utilized, and then tunnels are created in the cornea using this advanced technology. After creating the tunnels, the patient proceeds with the manual injection of the chosen dye during the treatment. The disadvantages of my depigmentation laser technique, the advantages are that it's not a surgery, so there will be no wounds or sutures. We apply only the laser without touching the eye, so there is no ocular contact, and we do not need anesthesia. There is no pain or decrease in vision. In addition, the recovery process is rapid, and there are no negative side effects whatsoever. Life is normal. The result is always natural, subtle, and has a permanent duration. A vital aspect is its future compatibility with all types of eye exploration and surgical intervention that will be performed or conducted in the future. In this illustration, we can observe some examples of cosmetic enhancement on the left that result in a completely natural look with a round pupil. On the right, however, we observe the case of a plastic surgeon who performed an intervention to treat a partial heterochromia in the left eye. Here are the outcomes observed immediately after the implementation of the treatment. The advantages of corneal tattooing's pigmentation are that it's just a single step, a single procedure. Even if the effect diminishes over time, touch-ups can be done up to a maximum of 3 times to maintain the desired outcome. There is a personalized choice of color, and the effect is particularly intense, especially in dark eyes. There is a personalized choice, but obviously the colors are not very realistic. As observed on the right side, the visual aspect is not similar to that of a typical iris. There is a presence of color in the eye, but when we capture close-up photographs, we refer to it as robot eyes, glass eyes, or predator eyes due to the unique appearance. Drawbacks of depigmentation laser: inability to choose the desired outcome during the treatment procedure. The laser removes the pigmented anterior layer of the iris, revealing the genetically determined color ranging from blue to turquoise and in dark eyes to gray. The color effect we achieve is not very significant. When the eyes are too dark, what we refer to as level 5, which is the highest level, requires multiple sessions to be performed. It is not only a one-time procedure, but it involves scheduled sessions. However, in certain situations, like autoimmune diseases and glaucoma, it might be contraindicated to treat the iris. Here we can observe on the left side the blue outcomes in eyes of grade 2 and 3, whereas on the right side there are the comparatively more gray outcomes in eyes of grade 4 and 5. Naturally, this technique must be carefully protocoled, because if the laser administration is unlimited, as proposed in certain locations, not only can we remove the front layer of the iris, but since the laser is a green laser and its absorption of melanin pigment is specific, we can penetrate the stroma and reach to eliminate the back layer of the eye, which could have serious consequences and require additional interventions for restoration. Ensuring a safe and effective treatment is crucial. The back should not be treated, as it provides the necessary protection from harmful ultraviolet rays that can cause sunburn and skin damage. Moreover, the pigment in the posterior layer is significantly denser and more resistant, enabling it to effectively and durably induce chronic glaucoma over an extended period of time. Remove posterior pigment, not anterior. We must understand how to proceed with the removal process. We can observe that these dark areas at the edges do not have the pigment of the posterior layer of the eye's iris. It has been removed, and in transillumination, as we can see in these photographs, we notice a transparency of the iris. As the pigmented posterior layer is no longer present, it has been treated. In our examination on the right, we observe a real patient who has undergone an excessive number of treatment sessions. This has caused a permanent dilation of the iris, which cannot be reduced. We conducted a study that we will now present on the future risk of glaucoma associated with my technique, the depigmentation laser technique, using tonography or measurement of intraocular pressure with the laser to remove pigment and assess its impact on glaucoma development. We therefore studied the patients before and after each laser session, distinguishing the levels of pigmentation. We were able to verify and statistically demonstrate that there is no variation over time with the progression of sessions, nor are there differences between the different degrees of pigmentation. Regarding tonography, it assesses the eye's function in draining intraocular fluid, demonstrating that we are not affecting this ocular function, and therefore there is no risk of glaucoma in the future. This method is crucial for monitoring and maintaining the health of the eyes, ensuring the prevention of any potential problems that may arise. Disadvantages of keratopigmentation include being a surgical procedure that may involve surgical and degenerative complications of the cornea. It can affect vision due to the creation, surgical complications, and the induction of irregular astigmatism in the patient. We are constructing tunnels in the cornea and have the ability to deform the anterior surface of the cornea, which can result in irregular astigmatism. Movements like the ones we have to make with the laser ring involve the visual axis and the anatomical axis, which often do not coincide. We can generate a misalignment that provides the illusion of pseudostrabismus due to the fact that the dye is not correctly aligned in both of the eyes. This can result in a mistaken perception of strabismus, despite the fact that it is actually an appearance of pseudostrabismus. The appearance is always artificial, like robot eyes. There is a gradual spread of pigment in the cornea because the cornea is water, so over time it spreads and loses its effect. The most important, most serious thing is that it will be incompatible with most of the eye surgeries that will be performed in the future. Clearly, in this particular situation, there are a few instances of irregularities in the central opening that cannot be overlooked or underestimated. They cannot depart from too small an aperture because otherwise the patient would be left with practically no range of sight. Therefore, the opening should be of sufficient size to ensure clear visibility of the actual pupil and the pigment of the real iris, which is situated behind it. I am about to conclude. Here we analyze the potential drawbacks. But what does all this ultimately lead to? As we can see on the left, to explore a retina, we need mydriasis. To dilate the eye in order to see the retina well. To carry out cataract surgery, it is necessary to dilate the eye in order to remove the cataract. In order to carry out a retinal detachment surgery, it is necessary to dilate the pupil, and for other glaucoma treatment techniques, laser and other methods are employed. So we will have the issue that we have obstructed the inside of the eye, meaning we have colored a large part of the cornea with a permanent dye and will not be able to perform all these types of examinations or surgical procedures, including myopia surgery with laser, because the pigment is in the cornea, so we will not be able to intervene again on the cornea, and it is totally contraindicated. Here we observe the disparity in visual aspect. Here we witness an instance of a favorable result of depigmentation laser treatment, showcasing a wholly authentic appearance. If examined by an ophthalmologist, he would not see anything at all, could undergo any examination, any surgical procedure for myopia, and aesthetically there would be no scars or traces left. Here we see an example of a successful case. This is a great example of a keratopigmentation procedure. It does not even compare to contact lenses. The appearance will always be superior with colored contact lenses compared to the faded pigmentation, as we can observe here. This is a patient who sent me these messages 2 weeks ago. She underwent an eyebrow pigmentation and asked for help because she had it done and realized by taking a photo and zooming in that she didn't like the result. She asked me if it was possible to remove the pigment, and I explained to her that it was impossible. You have been offered a laser procedure that involves removing the front part of the cornea, but obviously it cannot be done because it would result in a cornea thickness so thin that it would cause ectasia. This is the book we have recently published on laser eye depigmentation, and we are presently working on streamlining the process to execute the technique in a single step, which would be extremely advantageous for patients. There is no additional information available at this time. Thank you for your understanding.